Keeping warm this winter is hitting home. Some people are seeing utility bills doubling or even tripling since last month. Utilities are citing supply and demand. The spike even prompting Governor Kathy Hochul to call on one downstate utility to review its billing practices. Chase Hall here now telling us when people here can expect some relief. Chase.
Yeah, Don, unfortunately, we could see these high energy bills stick around until temperatures start to warm back up. Ian Layton says he was shocked when he opened his RG&E bill for January.
Our December bill was $106, and then our bill for January was $268, and there was no major changes in our energy usage.
Rochester Gas and Electric says natural gas prices are up nearly 100% in the U.S., and the demand for natural gas is outpacing the supply, and customers are feeling the pinch.
You know, one of the misconceptions that we're hearing is that RG&E bills are up. I would just caution folks to understand that RG&E does not control the supply side of the bill. That's simply the actual cost of electricity in the energy marketplace. And so while it's on our bill, it's simply a pass-through cost for customers.
Layton says he saw another spike like this back in September.
In the past, we've reached out to RG&E when the bill seemed way too high and we didn't really get much of an answer. We were told to look at the breakdown of the bill. And really, we didn't even reach out this time because this happens a lot.
Michael Jamison, the director of communications for RG&E, says the spike in energy prices shouldn't come as a surprise to customers.
We started alerting customers to the potential for higher prices really before the winter period, as we started seeing price forecasts increasing in the coming months. The winter period runs November to March.
Customers who are having trouble paying their utility bill are encouraged to consider options like RG&E's budget billing program or setting up a payment plan.
Certainly, we're all paying higher prices across the board and across the state. And, you know, unfortunately, market prices are up due to supply and demand. And we would encourage customers to call us if they're having trouble paying their bill.
Some other tips RG&E gave to conserve energy is putting plastic wrap over your windows and to fill any holes or cracks with caulk.
Amid a wave of violence in Rochester City Schools, district leaders are holding community meetings with the hopes of effecting change. RCSD's third session was held today. 13 WHAM's Natalie Kutchko explains some of the new developments. Natalie?
Dan, the district is holding a series of call to action meetings inviting RCSD to help build stronger relationships and a more inclusive and safe learning environment. Dozens of RCSD parents, staff members, and other community leaders met over Zoom Saturday with a continued goal of improving circumstances in and out of the classroom. Willie Robinson is behind one of the latest district-wide initiatives, bringing positive change through a group called Operation Fire, standing for Fathers Initiating Restorative Engagement. Robinson is one of many volunteers giving a smile and a friendly wave to students at Edison Tech and Franklin High Schools.
It's a safe space for them. You know, it's an opportunity for them to have some open dialogue with someone that they've seen as a trusted face.
Participants also focused on topics like social and emotional well-being in schools. RCSD Board President Cynthia Elliott took part and called for more accountability from these sessions, asking if they've started to make a difference.
We don't want to just do this to be doing this. We wanted to have some impact. And I know that our community doesn't trust us. So I really want to know if these sessions, if the Rochester City School District has really reached out to its partners and developed valued and valuable relationships.
Also, how we need to, as stakeholders, work together and how we need to make sure that we're informing you and parents as well. Having meetings like this, you're informing us, you know, everyone in all of our sessions. You're letting us see and know what we need to do to improve, and we appreciate that.
Going forward, leaders like Robinson say they plan to build off their efforts.
We're looking to be consistent, being very intentional about our movement, about how we're going to engage and how we want the students to view us, and we want the administration to view us as an extension of family in their specific communities at their buildings.
And those who took part in today's session were asked to complete a feedback survey for the district. The next meeting will be held in mid-March.
Arriving at local healthcare facilities.
While they can't do hands-on care, it will free up the staff that we do have to be able to provide care, direct care to the residents.
The National Guard will be arriving soon to help alleviate ongoing staffing shortages at nursing homes. 2 military medical teams arrived this weekend to help ease the burden at Strong Memorial Hospital. That is one of the many facilities that have been struggling with diminished staff. And as we hear from Jane Chaco now, nursing homes in Ontario County will see some relief this week.
Yeah, Don, the Continuing Care Center under Thompson Health is receiving 4 National Guard members who can assist staff but aren't trained to give direct care to nursing home residents. The M.M. Ewing Continuing Care Center in Canandaigua is down 20 full-time nurses. Tuesday, 4 National Guard members will arrive at the facility to help check in visitors, transport patients, and food prep.
While they can't do hands-on care, it will free up the staff that we do have to be able to provide care, direct care to the residents.
Amy Daly, head of long-term care, says she asked the state for help, and while the support is appreciated, the Guard members aren't trained to care for residents, the area where the center needs the most help.
The direct care staff are really why we're all here. It's who takes care of the residents every day, meeting their basic needs. Without them, the residents, aren't able to get their medications.
On top of staff challenges, nursing homes are pressured to meet state requirements. Soon, nursing homes will be mandated to provide 3.5 hours of care per patient. Daly says right now, they don't have the staff to do that.
There aren't many nursing homes in the area that can meet those regulations right now.
Nursing homes have been required to submit various COVID data daily since the pandemic began. Now that cases are down, Daly says collecting this data is time-consuming and takes away from patient care.
We've done a great job with keeping COVID at bay and keeping residents healthy and alive, quite honestly. But I don't think the industry can continue to go on like this. It's been 2 years. We need to start returning to normal.
And nursing homes are also facing another vaccine mandate. All employees must have a booster by February 21st. 54% of the staff at that continuing care center are boosted as of now.